All right, let's dive right in. We are breaking down the absolutely critical changes coming to Medicare in 2026. If you're on Medicare or you have a loved one who is, pay close attention. What we're about to cover could have a big impact on your wallet and your coverage next year.
So, open enrollment is officially here. This is your one shot each year to tweak your Medicare coverage. But with some major shifts on the horizon, the real question is simple. Are you financially ready for what's coming down the pike? And why the urgency? Well, get this. A whopping 70% of people on Medicare, they don't compare their plans each year. They just let them roll over. And as you're about to see, just letting it ride this year could be a seriously costly mistake.
Okay, let's get to our first big topic. Your costs are changing, and it's not just a small adjustment. Health experts are literally calling this year's enrollment period especially crucial, and we're about to show you exactly why. And look, don't just take my word for it. This warning from Whitney Stidham at eHealth says it all. Millions could face higher costs and fewer benefits. We're not talking about a minor tweak here. This is a big deal. That means you really have to be paying attention.
All right, next up. Let's try to solve what I'm calling the premium puzzle. Because, it's not as simple as everything just getting more expensive. Some key costs are definitely going up, but believe it or not, some are actually expected to go down.
And here's that puzzle in a nutshell. On one hand, your standard Part B premiums, for doctor visits, are set for a pretty big hike. But on the other hand, the average premium for Medicare Advantage plans is actually expected to drop. This is exactly why you can't assume anything about your costs for next year.
So let's put some real numbers on that Part B increase. The average premium is projected to jump from $185 a month all the way up to $206. That's a 12% increase. To put that in perspective, that's double the size of last year's hike. And here's where it really hits home. For millions of us, that premium gets taken right out of our Social Security check. Well, this 12% hike is expected to totally wipe out the 2.7% cost of living increase from Social Security. So what does that mean? It means even if your Social Security benefit goes up, the actual cash you take home could go down. Okay, so we've talked about your monthly premium, but now we need to talk about your other out-of-pocket costs. This is the money you pay for services before your insurance really starts to kick in. We're talking about things like deductibles and those spending caps.
Here's the first number you need to know. The annual deductible for Part B medical coverage is also projected to jump by 12%, hitting $288 in 2026. So that's how much you've got to pay out of your own pocket before Medicare starts to share the cost.
But now for some genuinely good news, especially if you have high prescription drug costs. There's a new rule coming in 2026, and it's a big one. It's a new annual cap on what you can spend out of pocket for Part D prescription drugs, and that cap is set at $2,100. This is a game changer designed to protect people from those absolutely devastating drug costs.
So this little table gives us a quick snapshot of the other moving pieces. The out-of-pocket limit for Medicare Advantage plans is actually going down a bit, which is fantastic. But the max deductible a Part D plan can charge is going up to $615. It really is a mix of give and take, isn't it?
And like Whitney Stidham says, these aren't just numbers on a page. For anyone living on a fixed income, these kinds of shifts in deductibles and copays can have a huge impact on your budget every single month.
All right, let's move on to something that affects about 81% of everyone on Medicare, prescription drugs. There are some really important changes happening with your Part D coverage that you need to know about. First off, your options are shrinking. The number of standalone Part D plans is expected to drop a lot. We're talking about over 100 fewer plans on the market. That means finding the perfect one for your specific prescriptions is more important than ever. But here's the upside, and it's a great one. For the very first time, Medicare is negotiating prices directly with the drug companies. You're seeing some of the first 10 drugs on this list right now. These are really common, really expensive medications, and the discounts could be massive. We're talking 38 to 79% off. That's a true game changer.
Okay, there's another thing we have to talk about, and that's drug tiers. Basically, your plan sorts drugs into different cost levels. But here's the catch. The tier your medication is in can change from year to year, even if you stick with the exact same plan. So a drug that's super affordable for you right now could suddenly jump to a much more expensive tier next year. Phew, okay. So with all of these moving parts, all these changes, what are you supposed to actually do about it? Let's walk through a simple, straightforward action plan you can use right now.
First things first, mark your calendar. The clock is already ticking. Open enrollment ends for good on December 7th. That is your absolute last chance to get this right for 2026.
So here it is, your 4-step checklist to make this easy. 1. Find that annual notice of change letter. It spells out exactly what's changing with your current plan. 2. Compare multiple plans side by side, and don't just look at the premium. 3, and this one is so important, double-check that your specific medications are covered and what tier they're in. And finally, number 4, remember you do not have to do this alone. There's free help available from licensed agencies.
So, is all this effort really worth it? Well, according to the experts, just taking a little bit of time to shop around could save you as much as $1,800 a year. I mean, that's a lot of money to leave on the table.
So we'll leave you with this one final thought. With costs going up, benefits changing, and that hard deadline of December 7th staring us down, now is the time to ask yourself this one critical question. Is the plan you have right now really the best one for your health and for your wallet in 2026?